have the kidney models where we have a sagittal view of the kidneys. And so now what we're going to identify would be kidney connecting to the renal pelvis, which would then go down and connect to a ureter, which, as we know, would go to the urinary bladder and then to the urethra, which we do not have a model of right now. So first, we would have the fibrous capsule, which would be the outer layer of the kidney, which is going to add protection, insulation, and then inside of the kidney, we're going to have the renal cortex, which is going to be this outer view. And then from the renal cortex, we are then going to have the renal medulla, which is surrounding the renal pyramid. And then in between each pyramid, where there's arteries and veins, is going to be the renal columns. And then again, here is the renal pyramid. And the renal pyramid is going to have a renal papilla or renal nipple, which is going to be the tip of the pyramid. The tip of the pyramid is then going to dip into the minor calyx, and that is going to be small cup. From the minor calyx, you're then going into a major calyx, which is going to be big cup. The major calyx will then connect down to the renal pelvis. Up here are going to be your renal lobes surrounding the renal pyramid and medulla. We also have the renal artery and vein exiting and entering throughout the kidneys. And from the renal artery, which then is traveling down to the segmental artery, and from there we will then go to the interlobar artery and then across the arcuate artery, which is going across the arch. From the arcuate artery, we're then going into the interlobular artery, which then is going to have afferent arterioles, which are then transferring over to the glomerulus. And from the glomerulus, we're then going to have efferent arterioles, which are then going to carry over to the peritubular. So through the vasa recta, we will then be going back to the interlobular vein, which is then going across the arch for the arcuate vein, and then down through the interlobar vein and back through the renal vein.